Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased that you could be with us for this next segment of Your Health. I'm delighted to welcome to our program a terrific surgical tech, Oscar Morales. Oscar, thanks very much for coming on the program.
Thank you for having me over on the show.
So, Oscar, I've been asking you to come on the program a lot. Now, I want everybody to know that Oscar is a surgical technician. Now, you're not an official representative of the hospital, but you work there now.
Absolutely.
And I asked you to come on the program because I think you're really good at what you do. And we want to teach people what the role of a surgical tech is. Is that okay?
Yeah, absolutely.
Okay, so let's start by talking about what your day is like and what is it like being a surgical tech. Let's teach them what a surgical tech is.
Okay. Well, basically, for my day-to-day.
Yeah.
So, it's just like any day. You know, you clock in for your shift. What a lot of people don't know is we don't get to wear the colorful scrubs like most places because they have to be specially laundered, by the hospital. So you can't just wear any old scrubs. You got to wear the hospital official.
Okay, so you wear the scrubs and you're in the operating room. So for example, when I'm doing an operation, my audience knows, of course, I'm a plastic surgeon, whether it's reconstructive surgery or I'm operating under the microscope or doing cosmetic surgery, whatever I'm doing, I have right with me a surgical tech, right?
Yes,
and many
correct.
times that's you. So let's talk about what a surgical tech does during an operation. Like, for example, let's talk about the instruments.
Okay, well, just like tools like anyone would use, there's various types of instruments that do certain things. Some are more, how would you say, finer instruments as opposed to something where you need a little bit more grasp, hold. It's my job to basically hand the right instrument to a physician or Dr. Morwood, and basically just assist, make sure, very important job actually is counting the sponges and needles, making sure nothing gets lost inside the patient or dropped on the floor.
Okay, so see, Oscar, what I think is really key is we want the audience to know that, of course, they're very conscious of the surgeon and the role of the surgeon, and they know pretty much they know what the surgeon does.
Right.
But I want them to know that there's a team around the surgeon, right? So you're right there with me. So if I need a scalpel or a Kelly clamp or I need a needle driver or a different type of forceps, part of your job is to have those instruments ready. Isn't that right?
Absolutely. Before this patient comes into the room, before even the surgeon may stick his head in the room, it's very important for me to come in and set the room up, make sure we have everything we need basically for the surgery. Every surgery and surgeon is different, so we get cards that tell us exactly what we need for the surgery. So it's my job to go down the list, make sure everything's there, and nothing less, basically. Just make sure we're all prepared and we're ready to go.
Perfect. Now, Oscar, sometimes a patient will be interested to know, let's say they come in for an operation into the operating room and they're going to have a general anesthetic, they're asleep. They want to know, what about the sterility of the instruments and the sponges? How do they know that things are going to be sterile?
Well, that's a good question. A lot of manufacturers produce their items that they provide for surgery, one-time use items, and as opposed to the reuse items. Every single one of those different type items has to pass a certain test of packaging, sterilized to the right degree of heat. So we check all the instruments as we open them, and the packages we check their integrity and make sure there's nothing wrong. They're not moist, or basically everything's there, and pretty much it.
Perfect. So in addition to assisting me during an operation, like I may ask you to hand me an instrument or hold a hook or hand me a sponge or something like that, it's your job to get the instruments ready and lined up and make sure they're all sterile. Isn't that correct?
Yes, absolutely.
So and it's not just the surgeon that has on sterile gloves and sterile gown and mask, etc. You, as the surgical tech, do as well, right? You have a mask on and gloves, and so you're right there.
Absolutely. We are right there from beginning to end of the surgery, just making sure everything's sterility is not compromised whatsoever for the patient's safety and pretty much the safety of everybody else on the team who's scrubbed in.
Perfect. Now, Oscar, let's back up a little bit. Now, for example, I've complimented you, that the audience knows. They've heard me say that I think you're an excellent tech.
Thank you.
How did you get your education? Like, how did you learn how to be a surgical tech?
Well, I basically, after high school, I knew I wanted to do something in the medical field, but I didn't know exactly. So I did some research, and I found that there's programs that specifically offer surgical technology. So I am actually a certified surgical technician through the state of California, but my license allows me to work in other places throughout the U.S. So I did the research, and I called the school where I got my education in Sacramento, and it was about a year-long course with a 2-month internship, and I became a surgical technician. I've been working since 2006.
Okay, Oscar, so I think that's important, so let's go over that again. Mm-hmm. So you went to through an actual training program,
right.
Surgical tech school, mm-hmm. and it took about a year, did you say?
Yeah, it was about a year, Monday through Friday, and all it was is surgical technology. Just everything from knowledge of instrumentation, aseptic technique, pretty much everything there is to be about a surgical tech.
Okay, perfect. Now let's teach the audience what we mean by that phrase, aseptic technique. What does that mean?
Well, basically, aseptic technique is the absence of sepsis. Basically, anything that can harm the patient, such as bacteria, bloodborne pathogens that can complicate the surgery with infections, things like that. Basically, we do everything in a sense where we're meticulous. We make sure that nothing is compromised whatsoever with the instruments, the packs, and there's just a way to do everything in surgery to make sure that we don't contaminate anything, the instruments, implants, whatever it may be.
Perfect. So, Oscar, how can a patient be confident that when they go into the operating room that the tech and the surgeon, say, will be using sterile gloves or sterile instruments? I mean, is there something that we can provide as reassurance, or how do they get confident that things are going to be sterile?
Well, basically, what we have actually in the packs and the instruments are these little devices called integrators, where once they are properly sterilized to the right temperature, these indicators will turn a different color. So once they turn black for pretty much all of them, they turn from white or gray to a solid black. So that's what we look for, Dr. Morwood, is to make sure that all the indicators, everything is just, you see that little black dot or black paper, that means that the instruments or whatever you're using is properly sterilized to the right temperature. So it gets pretty hot too. So
perfect. So in the uncommon possibility that you may be handed an instrument pack and something doesn't look right to you, or you look at the indicator and it's not proper, in the unlikely event that that happens, you don't just go ahead and use those instruments, or you don't hand them to me. Isn't that correct?
Yes, that's correct. That's actually what is known as sterile conscience. We are the front line for making sure all our packs and instruments are properly sterilized and well maintenance. Basically, if I know something's wrong, I wouldn't hand it to the surgeon, because the surgeon really relies on us to check those things for them. It's just kind of like, dropping a piece of food on the ground. You don't put it back on the plate and give it to somebody. Perfect.
Oscar, I've thought many times of other technical fields. Maybe a pilot will have a co-pilot, there'll be a flight attendant, etc. Mm-hmm. Even a master carpenter will oftentimes have an assistant, right? Like an apprentice or a journeyman, etc. someone to care for the instruments or select the instruments. For example, there's certain times during the operation where I can't take my eyes off the field, right? I can't look away from the microscope. I'm taking care of a blood vessel or a nerve or even doing a facelift. There are certain times when I have to rely upon you to just hand me the proper instrument and make sure it's still sterile. Isn't that correct?
Yeah, absolutely.
And I think you're good at what you do, Oscar. That's one of the reasons I asked you to come on the program. You're really good at that.
Well, thank you. I appreciate that.
So, Oscar, you know, if someone were to walk into the operating room and they saw the operating room or your tech table, there must be over 100 instruments on that field. And it takes a year, right? I mean, that's just one training program. It takes a year to become a surgical tech. So how did you learn the instruments? How did you learn the difference between like a Kelly clamp and a cryle and a needle driver and a forceps with teeth and a plane? How did you learn all those instruments?
Well, once you're in tech school, you basically you go to these training labs with a combination of sitting down and reading books just on instrumentation. I mean, you spend weeks, a couple of months just going over the instruments, their functions, because not every instrument, although may look similar, doesn't serve the same purpose.
Right. So we've been together at certain times in the operating room where there's a fair amount of pressure. There's a little bit of, I won't say tension in the air, but there's a fair amount of pressure, and the surgical team relies upon you to know the names of the instruments, have them ready, and be able to hand them to us appropriately and expertly. And I appreciate when you do that, because I can tell the difference between a tech who's an expert and who's not. So tell us more about the training. Like, what's that 1 year period like? You said you went to Sacramento.
Yes.
And there was a 2-month internship, I think you said?
Yeah.
So tell us more about the training to become a tech. Let's say, for example, Oscar, that we have some high school students who are listening, and they say to themselves, you know, I want to learn more about becoming a surgical tech, or what is it like to become a surgical tech. What could we teach those high school students? Well,
basically, anybody can just, you know, if they really wanted to know what a surgical tech is there's the forums online, websites for the school, blogs, also volunteering through the hospitals. A lot of hospitals are willing to let you meet a surgical tech, maybe even come by and see how an operating room runs, and that'd be a great way. I did mine mostly through research, and I did actually talk to a surgical tech before I became one.
So, Oscar, you've been a surgical tech since when?
August 2006.
Perfect. So, 7 years.
Yeah, yeah.
No end in sight.
You know, I'm going strong, so I really love what I do. You know, I wake up every day, and I'm happy to come to work.
Well, Oscar, I think part of that is because you're good at what you do. So, and I mean that. So let's talk a little bit more about the counting. You know, I don't want to raise the anxiety level of the audience, but sometimes people come to the operating room and they're worried about, they read about a sponge was left inside somebody, or somebody left a clamp in somebody, or the count was wrong. So let's talk about that. How do we minimize, or what we really want to do is eliminate the possibility or eliminate the risk of leaving something where it's not supposed to be? How do we do that?
Well, actually, Dr. Morwood, a lot of the times what happens is, in those incidences, is sometimes you just can't prepare for a lot of what happens when those instruments or sponges get lost, because most of the time those are actually trauma surgeries where the patient has to be taken to the OR immediately and be worked on. Fortunately, we have a little bit of a different setting where me and Dr. Morwood work together. We take the right measurements. We take our time and we go through the instruments. We count everything, sponges, needles, everything gets counted for, and we follow protocol and policies of the hospital to make sure that we ensure patient safety when we're counting all the instruments and sponges.
Well, Oscar, you know, it feels to me, or I see a lot of similarities. I did some flying with the Navy. Mm-hmm. It feels to me that there's a lot of similarities between the checklist that we have on board a plane or a jet, and the checklist in the operating room, because it's very systematic.
Yes.
Every team member needs to be compulsive about doing their job, right?
Yeah, absolutely. That's actually, that is part of the timeout process, where everybody stops and we make sure we check the patient's identification band on their wrist. We go through a checklist, make sure the patient has antibiotics, the surgical site is marked, everybody's aware of what they're doing. Anesthesia will report if they're doing a general or a MAC or their choice of anesthesia, and we all basically confirm that we're here and we're working on this patient, and this is what we're doing.
Right, and we speak right up, and if anyone has a question or is anxious or not sure, we just continue the timeout till everybody's satisfied.
Absolutely.
Well, Oscar Morales, surgical tech, I'm delighted to bring you on the program, have you teach people. I've complimented you in the past, and I am just delighted that you could come on the program and teach people about what you do. Oscar Morales, surgical tech. Now, again, we have about 20 seconds. If somebody has a question about how to become a surgical tech, what would you tell them to do?
Basically, you can go to, if you're a high school student, go to your guidance counselor. They will have pamphlets, information for surgical technologists, or just go online and search engine, surgical technologists, and you can find many ways. There's many schools out there.
Perfect. Oscar Morales, surgical tech. I appreciate you coming on the program.
All right.
Great to have you here. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is your health television program. We're going to come right back after a very brief pause for a very good cause.